It is quite positive to see the increase in percentages and to see that there was actually an increase in total donation amounting to 29%. But worrying still is that until this day and age, the demand for organs continues to outstrip supply. And as the presentation showed, during 2012, for example, you have 4,000 patients within the European Union that lost their lives while on a waiting list for an organ transplant. And by the end of that year, worrying still is the amount of 64,000 patients that remained on the waiting list. And these are figures that actually show the need to push as much as possible and to promote as much as possible organ donation and to have the proper legislative framework in this regard. And if I may, Chair, I would like to take this opportunity to emphasize the importance of organ donation, because if I had to quote the United Network for Organ Sharing, there is one quote which, in my opinion, really drives the message home, when it is stated that without the organ donor, there is no story, there is no hope, there is no transplant, but when there is an organ donor, life springs from death, sorrow turns to hope, and a terrible loss becomes a gift. And in my opinion, this message really drives the message home that organ donation needs to be promoted even further in all the member states. But I do understand that the European Union has limited competence to act in the field of public health, and in most cases the scope for EU action extends mainly to encouraging cooperation between member states. Nevertheless, I honestly appreciate the work and efforts that have been done in order to adopt and implement legislative measures for setting high standards of quality and safety for human organs.